Thank you so much, Sandra, for that. I've been frantically scribbling through all your presentations, making sure that I'm ready for a productive Q&A session at the end of this panel. Just before I introduce our next and final panelist for panel one, just a really brief note for people who are still arriving. If you could just try to make sure that you have yourself muted, that would really help us. We also have a tech wizard doing that, but you can help us out that way. So our final presentation for panel one is Dr. Jacquie Gahagan, who is the Associate Vice President of Research at Mount St. Vincent University in Halifax, Nova Scotia. Previously, they were a full professor in the Faculty of Health at Dalhousie University. Jacquie is also a founding fellow of the McEachern Institute for Public Policy and Governance, and also serves as a scientific officer for the Canadian Institutes of Health Research, CIHR. Dr. Gahagan evaluates policy and programming interventions in order to identify and address health inequities among marginalized populations. For example, individuals affected by sexually transmitted and blood-borne infection. Dr. Gahagan's research also addresses innovative HIV testing technologies, older 2SLGBTQIA populations and their access to safe and affirming housing, primary healthcare utilization among 2SLGBTQIA communities, and end-of-life decision-making. So welcome, Jacquie.
Bonjour tout le monde. Hello, everyone. I hope you can hear me okay. We're having some technical issues here and the signal keeps dropping. So in addition to turning off mics or muting ourselves when we're not speaking, it might be a good idea. And you may have said this and I missed it. If people could shut their cameras off. I'm not sure if it's at my end or where it's coming from, but the signal is quite, seems to be quite weak. It might be related to the weather we're having. At any rate, I'd like to thank the organizers for inviting me to be part of this important discussion. And I'd like to start by acknowledging that Mount St. Vincent University is located on unceded, unsurrendered territory of the Mi'kmaq, and that we're all treaty people. I'd like to also thank our partners, our funders, and our collaborators who made this research possible. There is a lot more information about this study that can be gleaned from our website, and I'd be happy to provide that information at the end of our session today. But for the sake of brevity, I'll motor through this. So what I would like to do today is talk a little bit about the background issues related to 2S LGBTQ issues, and then talk a little bit about the purpose of the study of our Social Sciences and Humanities Research Council funded study, and then give you a little bit of a snapshot, if you will, of some key data from this study. But what I'd like to do right now is start with some background information. And again, apologies to those of you who are familiar with this background and this sort of contested terrain around terminology. And you'll note that in my presentation slides, I use the term LGBT Canadians, and this was in part in consultation with our partners. And we know that the sort of terminology has changed over time. And so the use of LGBT in this particular study is in no way meant to diminish the other identities that are part of our community. So that's just a little disclaimer before we get started. Again, this is not new news, sadly, to those of you on this conference, but really when we think about older LGBT Canadians, we need to think about a variety of intersecting health and social issues. So this includes things such as, and this has been spoken to already by our earlier presenters, but it's important to note that despite advances in LGBT human rights legislation and law, we need to recognize that there's a long history of systematic discrimination against LGBT Canadians. And we need to also keep in mind that same-sex sexual activities between consenting adults were criminalized up until 1969. This is also a contested flashpoint because we know that despite this change in 1969, that violence and discrimination continue to occur. And so for baby boomers, this decriminalizing of same-sex sexual acts was a watershed moment, but clearly not enough to address ongoing discrimination. So other protections for our population were not in place for many decades following, and this includes protections such as recognition of same-sex marriage. So there are a variety of existing policy knowledge gaps that have been important and continue to be important in relation to the topic for today, which is around housing and care. And again, some of you may be familiar with the sort of trajectory of key LGBTQ2S policy developments in Canada. And I'm just giving this a brief overview for the sake of grounding the conversation that we're going to be having in my presentation. So really, when we think about these changes over time, we have to also think about in 1992, the federal government lifts its ban on homosexuals in the military as one example, and yet we see the need for a class action suit against the federal government, which resulted in the purge and the subsequent apology from the Prime Minister in 2017. So again, this is a very important piece of our history and something to be mindful of when we're thinking about issues such as housing and care. Now, I'm just going to speak very briefly about our Social Sciences and Humanities Research Council funded study. But I want to start with a backgrounder in determinants of health. So we know that health is an amalgam of a variety of intersecting issues, including individual lifestyle factors, social community networks, and broader general socioeconomic, cultural, and environmental conditions. And this is an important model in the work I do in health promotion, because it really does speak to the importance of not just focusing on one issue, but looking at the pressure points on that issue, in this case around housing, and how that can actually affect other parts of people's lives. We also know that there are a variety of structural determinants of health that are intersecting and affect us across the life course. And I think we've heard from our earlier speaker about the importance of keeping this in mind when we have these conversations about what are the key drivers of health and social inequities that are facing our communities. I'm just going to use this example from the US. So despite the fact that we acknowledge that structural determinants impact our health and social and economic outcomes, in the US, there are 31 states that still have no law against housing and employment discrimination. And this continues to be a problem, I would argue, depending on who is in a position of power in government to decide whether or not employment or housing discrimination is okay in their respective state. We see that pressure point happening in the Canadian context as well, where we may have federal legislation, such as those that I've alluded to earlier in my presentation, but how those actually are enacted at the provincial level or municipal level is, again, something that's highly contested and something that needs to be taken into consideration around the issue of housing. I just also wanted to mention the fact that the SHIRP grant grew out of our earlier research with the European Union Centre of Excellence. And what we did is we looked at housing models for older LGBT populations in select EU states, and we actually found some really interesting, innovative models. And one of the issues that we thought would be interesting to look at in the Canadian context is housing as a portable benefit. Again, we can see that in select EU states whereby older LGBTQ folks may be able to move to another EU member state where housing affordability or housing availability for LGBTQ seniors is better. We also see that housing is a key site for health interventions and programs, and there were some beautiful examples. One that comes to mind in Germany, whereby individuals who may have varying health concerns or issues can continue living in the same facility over time, and that facility is largely staffed by members of the LGBTQ community, which I think addresses some of the questions and concerns that we heard in Sandra's talk, whereby you don't have to take the training, but you're encouraged to take the training. And for individuals who prefer not to take the training, then they simply don't have that sort of competency in terms of how they're providing housing or care to older LGBTQ populations. We also found some interesting examples in the EU literature on addressing the needs of LGBT adults in relation to aging in place, which we see in a lot of policy documents in the Canadian context, and the question remains, how applicable are those for our communities? And so all that to say that in the work that we've done in the EU, we see that there's the need for more innovative policies and programs in the Canadian context to help meet the needs of older LGBTQ Canadians from a population health perspective across the life course. So our team focused on a study called Addressing the Knowledge Gaps and Meeting the Housing Needs of Older LGBT Canadians from Research to Policy to Practice. And this project consisted of 3 core parts. The first part was a scoping review of existing housing policy documents. The second piece was looking at an online survey from LGBTQ Canadians across the country. And as Elsa already pointed out, we had a variable uptake, particularly in smaller areas or more rural and remote areas of the country, which remains a challenge. We also then conducted a series of focus groups with older LGBT Canadians on their experiences and perceptions in meeting their housing needs. So I'm just going to briefly talk about a few of the key findings. And as I said, this material is also available on our project website. So what we did in terms of the study is we undertook an international literature review. We then used the international literature review to develop the questions in our online survey. That survey went out broadly through our community partners, and we're very grateful to our community partners for pushing that information out about the survey. We had 982 respondents. Not all of the surveys were complete. And then the last component was using the data both from the scoping review and the online survey to develop a series of focus group questions, and we held those with our community partners in various places across the country, including Halifax, Ottawa, Winnipeg, Calgary, and Nanaimo. In terms of key findings from the scoping review, this is just giving you an overview of the inclusion criteria. In order for those policy documents to be included in the scoping review, they had to examine one or more segments of the LGBTQ community as part of their study population. They had to examine a specific residential context, and they had to examine issues around accessing a residence or amenities related to quality of life in that residence. So in terms of the key scoping review findings, we organized our literature into these various content areas, if you will, and there were a total of 176 documents that made the inclusion criteria. The first one, and one of the largest areas that we found in the literature, was homelessness or homeless-related issues of precarity. So in other words, people might be couch surfing, or they might be staying with friends or relatives, or they may not actually have a permanent home. We also found a lot in literature around perspectives on aging and care, which is really an important area. And then you can see the various other issues that were raised in the international scoping review. Now, what was sort of the takeaway message from the scoping review was that most of the studies were descriptive. So they sort of tell you what the problem is, and they tell you how many people participated, et cetera. But very few of the studies were actually focused on housing interventions. So in other words, in addition to describing the issue, providing concrete interventions or solutions, we didn't see a lot in the literature around that. And as a result, there was very little focus on system level solutions, such as policies, developing policies that can be instituted, evaluated, and monitored over time. So what does this mean? The longstanding tension between the realities of LGBT populations in housing and the need for better, more flexible policies, programs, and funding models, and the need for more focus on policy and system level drivers, as well as the need for better administrative data on LGBT populations. I'm just going to continue assuming that you can hear me and that the signal is strong enough that this is actually you can actually follow my presentation. So apologies if the signal keeps cutting out. In terms of the online survey, we had the vast majority of individuals who participated were from Ontario, Nova Scotia, and British Columbia. The average age was 55. The vast majority identified as white, and 6% as Indigenous, and the remainder identified as other. When we asked how people self-identify in terms of their sexual orientation or gender expression, we had queer, gay, and lesbian as the top 3 self-identification. And what's also important to note is that 35% of the survey respondents noted that they had a disability, and of those, 80% noted that it was an invisible disability and 11% reported a visible disability. In terms of the additional key findings from the online survey, we found that the average income was between 20 and 49,000. We found that the main source of income was 60% of those who participated said it was from employment, and 25% noted it was from a public pension. When we also, we asked the question, what type of housing are you currently in? You can see on the slide the breakdown by type of housing. So the majority stated that they rented an apartment. We asked about housing challenges, and these included, for example, 38% suggested that rising rate was one of their most significant challenges. 20% had to move due to unaffordability of their housing. 6% stated that they had been evicted. 5% were homeless. 1% had a foreclosure, and 31% a variety of other reasons for housing challenges. We also asked if the participants have had a negative housing related experience in the last 5 years, and 36% rather of our participants said yes. When we asked why, 15% said they were uncomfortable discussing their sexual orientation with their landlord. 10% were uncomfortable discussing their gender identity or expression with their landlord. 9% were uncomfortable due to heteronormative intake forms, so where an example is that sort of gender binary. Are you a Mr. or a Mrs.? Are you male? Are you female? And then 9% because of a non-inclusive space, and 7% reported that their identity was not reflected in their surroundings, so posters, signs, etc. When we asked, did you have a positive housing related experience in the last 5 years, 50% said yes, and we asked why. 19% of that 50% reported that they were in an inclusive environment. 19% felt comfortable discussing their sexual orientation with other residents, and 17% reported that staff and the landlord were LGBTQ friendly. In terms of the focus groups, as I mentioned at the beginning of this talk, focus groups took place in Halifax, Ottawa, Calgary, Winnipeg, and Nanaimo with older LGBT adults, as well as social providers and housing providers on their perceptions and experiences with housing. And it was really quite interesting because the focus was really about issues such as affordability and safety, as we heard in our earlier data that we had collected in the study. And some of the key issues included the lack of LGBT focused options, the need to hide one's sexual orientation and or gender identity from other residents or housing providers, harassment and violence from residents and or community, and fear of being too visible, being ostracized by non-affirming staff, lack of LGBT homelessness support, and loneliness and isolation, which we've heard our earlier speakers talk about. So just a few key findings from the focus groups. There was no respect, and this is a quote from a Calgary participant, there was no respect given in the shelters for people who are queer or have a different gender identity. We heard from a Winnipeg focus group participant that there's lots of fear about housing, whether it's non-accepting neighborhood, and that where there are protections or policies, they're not being enforced. And then lastly, from a Winnipeg focus group participant, we heard, especially in care homes, I've heard bad stories about how people in those places are being treated badly. So what can we do about these findings? Well, we can advocate for a national program of housing research specifically focused on older and younger LGBT Canadians using an intergenerational justice perspective, which our team has done some writing in that area. Seek additional sources of funding to move this work forward. So take the key findings from the work that is being done and mobilize for additional funding. And then to continue to mobilize our findings within the housing sector and having conversations with individuals who are part of co-ops or assisted living or long-term care, include builders, planners, and architects, as well as government and community members, and then to develop LGBT housing business plan for funding from CMHC. And I just wanted to note, I know one of the the speakers mentioned the fact that the Canadian Mortgage and Housing Corporation has a housing strategy, and I would argue, yes, we do, and it's really important because it's over $50 billion of money going into solving complex housing issues in the Canadian context, with two key priorities, one being homelessness and the other one being housing affordability. However, in that national plan, there is simply a passing reference to the needs of LGBT Canadians, and I think we can do more and we need to do better in terms of how CMHC and others are actually meeting the housing needs of our communities. So by way of conclusion, then, I'd like to thank our international team, which is made up of over 40 partners from 5 countries across academic, community, research, government sectors, and we are a multidisciplinary team, and we're folks that are focusing specifically on the lived experiences of LGBT Canadians. And I'd like to also thank the McEachern Policy Institute for Public Policy and Governance for their support for this work. And you can find more information about the policy briefs that have come out of this study on the McEachern Institute website. And I'd also like to thank the Healthy Populations Institute at Dalhousie University for their support for this research. If you'd like more information, you're welcome to reach out to me at my email address here. Merci beaucoup. Thank you very much, everyone, and I'll stop there. Thank you.
Thank you so much, Jackie. I really, really appreciate that. I'm going to rush a little bit more than usual right now and just inquire whether or not Dr. Giwa is still here. I know that he had to leave at 10:30, so he may be gone already. And if he was here still, I just wanted to offer him the opportunity to say anything he might want to say before he's gone. Is he already gone, Elsa?
No, I'm still here.
Okay, so I just wanted to, because you have only 3 minutes before you need to be somewhere else, and I just wanted to see if there was anything you wanted to ask or ask one of the other presenters, and to thank you very much before you need to go.
No questions for me. Just thank you to the organizers of the conference for the opportunity to be here today. And I hope that what I had to say or contribute was helpful, beneficial, help to move and support the agenda, excuse me, the agenda for the conference. Also, I know that there was a question in the chat function earlier around how to access the report from the study that we did. The link is already up there. So if if you need any further information about the study itself, please, I encourage you to visit Quadrangle NL to download the report itself. And by all means, reach out to myself or Dr. Craig if you have any questions. Thank you so much.
That's wonderful. Thank you so much, Dr. Giwa. And we also have these links for these reports. So if anybody misses the individual emails of the scholars, you can always just contact us at Gay and Gray and we'll set you up, okay? So thank